Hi, myself Srija. Today you are going to learn about the anatomy and physiology of endocrine glands. You will be able to know about the adrenal gland, pineal gland, pancreas, ovaries and testes, and also about the conditions and disorders of the endocrine system. Now, the first one is adrenal gland. What are adrenal glands? You can clearly see a picture of adrenal gland on the right side. So these are called as suprarenal glands. Why they are called as suprarenal glands? They are two small triangular endocrine glands which are located on top of each kidney. You can see here in the picture, on each top of the kidney you can see a adrenal gland. The right adrenal gland on right side of the kidney and the left adrenal gland on left side of the kidney. So they play a vital role in producing hormones that help regulate metabolism, stress response, blood pressure, and also the electrolyte balance. So they lie retroperitoneally behind the peritoneum, retroperitoneally, nothing but behind the peritoneum. I said peritoneum means it's an outer layer, right? So behind the peritoneum, the name itself gives you the meaning. So they are located on the upper poles of the kidneys. So each gland is surrounded by a fibrous capsule and also the perirenal fat which protects and hold it in a place. So when coming to shape and size of the adrenal glands, the right one is triangular in shape. So whereas the left one, it is crescent shape. So shape of both the adrenal glands are not same. And this right adrenal gland, it lies close to the inferior vena cava, whereas the left adrenal gland, it lies near the aorta and spleen. So each gland measures about 5 cm long, 3 cm wide and 1 cm thick, weighing about 4 to 6 grams. So each adrenal gland, and this picture, coming to this picture, each adrenal gland has two main parts. So what are they? Adrenal cortex and adrenal medulla, right? You are seeing it, right? Adrenal cortex and adrenal medulla. This is the outer layer. Cortex is the outer layer and medulla is the inner layer. So this cortex, adrenal cortex, it makes up about the 90% of the complete adrenal gland. So it has three zones within the cortex itself. So what are the three zones? Namely, zona glomerulus, zona fasciculata, zona luteolaris. So these three zones have a different hormone secreting, and these hormones, they perform different functions. The first, the outer zone called as zona glomerulosa, and this hormone and this zone, it secretes the aldosterone hormone. This hormone, it functions. What are the functions of aldosterone hormone? It controls sodium and potassium balance and it regulates the blood pressure. So coming to the middle zone, zona fasciculata, and this zone, it secretes cortisol hormone. This cortisol hormone, it helps to control metabolism, it reduces inflammation and also it manages the stress. And the third zone, the inner zone called as zona reticularis, and this zone, it secretes the androgen hormone. What is the function of androgen hormone? It contributes to the development of secondary sex characteristics. This is all about the adrenal cortex, which is the outer layer. Now coming to the adrenal medulla, which is the inner layer, it is made up of the chromaffin cells. These cells, this acts like nerve cells, right? And this chromaffin cells, it secretes adrenaline and also the noradrenaline hormones. These hormones, it prepare the body for fight or flight during stress. So these adrenaline and noradrenaline hormones are also called as fight or flight hormones because they prepare the body during the stress. How it prepares? By increasing the heart rate, blood pressure and also the energy supply. Now how does blood supply to the adrenal glands? Arteries. The superior suprarenal artery, it supplies blood from inferior phrenic artery. And next, middle suprarenal artery, it supplies blood from abdominal aorta. And inferior suprarenal artery, it supplies the blood from renal artery. When coming to veins, right suprarenal vein, it drains into inferior vena cava, whereas left suprarenal vein, it drains into left renal vein. Now, how does nerve supply to the adrenal gland? From preganglionic sympathetic fibers, that is T10 to L1 segments, the nerve supplies us, and especially to the medulla. This medulla, it acts as a modified sympathetic ganglion. So you have to keep noted about adrenal gland. The key point is these adrenal glands are vital for life. Their hormones help the body to respond to the stress, maintain blood pressure, and also to regulate the energy and electrolyte balance, right? And next, coming to the pineal gland. So what is pineal gland? It is also known as epiphysis cerebri. Epiphysis cerebri, and this is a small pine cone shaped endocrine gland located deep in the brain. So this pineal gland, you can see the picture of pineal gland. It is present in between thalamus and hypothalamus. So this pineal gland is situated in the midline of the brain between the two cerebral hemispheres. So it lies below the back part of the corpus callosum and above the superior colliculi of the midbrain. So this is the midbrain, right? In the picture, this is the midbrain. This part is the midbrain, and its pineal gland, it arises at the back part of the corpus callosum, and this is attached to the roof of the third ventricle by a short stack. When coming to the size and shape of pineal gland, it is a small pine cone shaped structure, hence the name called as pineal. The name itself, because as it is a pine cone shaped structure, it is called as pineal gland, and it is about 5 to 8 millimeter long, and it weighs around 100 to 180 milligrams. For appearance, it's grayish red in color. So coming to the structure of the pineal gland, there are two main types of cells within the pineal gland. What are the two main types of cells? Pinealocytes and glial cells. These pinealocytes, these are the main cells that secrete the hormone called melatonin, which is a sleep hormone, and also the glial cells. These glial cells, these are the supportive cells that help to maintain the structure and function. So over time, the calcium deposits accumulate, making the pineal gland visible on the X-rays. So deposits of calcium, so makes the pineal gland visible on the X-rays. So what is the function of the pineal gland? What does it do? It secretes the hormone called melatonin. I already said before itself. This secretes a hormone called melatonin, which is also called as a sleep hormone, because this helps to regulate the sleep-wake cycles, nothing but circadian rhythm. It controls the body response to light and also the darkness. More melatonin is secreted at night and less during the day. It also influences the reproductive hormones, especially during the puberty. Now, how blood supplies through pineal gland? It is supplied mainly by the posterior choroidal arteries and also the branches of the posterior cerebral artery. And venous drainage occurs through the internal cerebral veins. Coming to the nerve supply, it receives the sympathetic nerve fibers from the superior cervical ganglion, and the left signals from the eyes indirectly control melatonin secretion through the hypothalamus. So what is the key point of pineal gland? It acts as the body's biological clock, because it synchronizes various psychological processes with the day-night cycle through the melatonin secretion. So this is all about the pineal gland. And next, we'll talk about a pancreas. So you can see a picture of pancreas. It's a very colorful picture. And so what are pancreas? It's a soft elongated gland located in the abdomen. This pancreas, it performs both endocrine and exocrine functions. And in total of the endocrine glands, pancreas is the only endocrine gland which performs both the endocrine and exocrine functions, because it acts as both a gland and also an organ. It plays a vital role in a digestion. Digestion means by secreting digestive enzymes into the small intestine, and also it helps in regulation of blood sugar levels by releasing hormones like insulin and glucagon. So A pancreas is both a digestive organ and also an endocrine gland. So when coming to location of the pancreas, where pancreas are located? So they are located behind the stomach in the upper abdomen. It lies horizontally across the posterior abdominal wall, extending from the duodenum right side to the spleen left side. It is retroperitoneal organ because it lies behind the peritoneum as same as the adrenal gland except for a small part of its tail. Now look at the picture. You can find the head of the yellow color one. You can find the head of the pancreas, body of the pancreas, tail of the pancreas. In between head and body, you can find the neck of the pancreas. So pancreas has four main parts. What are they? Head, neck, body and tail. Right? So coming to the head, it's a broadest part. It's a C-shaped curve. You can clearly see it's look like a C-shaped curve of the duodenum. This is the gallbladder and this is the jejunum and this is the duodenum. It fits into the C-shaped curve of the duodenum. It contains the uncinate process, a small projection that extends behind major blood vessels. So next to the head, there is a neck. A neck is a short and narrow portion behind the head and body. It lies in front of the major blood vessels like the superior mesenteric artery and also the vein. When coming to the body, it's an elongated central part, right? Body is always a central part. So it's an elongated central part. It crosses the midline of the body lying behind the stomach. And then next part, the next to the body, it's a tail of the pancreas. So this is the narrow end near the spleen. So next to the tail of the pancreas, you can see spleen over here. So it is the narrow end near the spleen, the only part of the pancreas that is intraperitoneal. So except tail, the remaining parts of the pancreas are retroperitoneal. But tail is intraperitoneal because it is covered by the peritoneum. Now, how does the blood supply to the pancreas? Through splenic artery, it supplies the blood to body and tail mainly. Whereas superior and inferior pancreatic duodenal arteries, it supply blood to head and neck. So for body and tail, splenic artery supplies the blood, whereas to head and neck, superior and inferior pancreatic duodenal arteries supply the blood. So how does vein supply the blood? It drains into the splenic vein and superior mesenteric vein which join to form the portal vein. Coming to the nerve supply. So parasympathetic fibers and sympathetic fibers helps in the supply of nerves. So parasympathetic fibers from the vagus nerve, it stimulates the secretion, whereas sympathetic fibers from splanchnic nerve, it inhibits secretion and constrict the blood vessels. I already said you, pancreas has both endocrine and exocrine function. This exocrine function, it is nothing but the digestive function, whereas this endocrine function, it is nothing but a hormonal function. So it has two main functional parts, exocrine part and endocrine part. This exocrine part, coming to the digestive function, it makes about 98% of the gland. It contains the acinar cells that produces digestive enzymes like amylase, lipase and also protease. These enzymes are secreted into pancreatic duct which joins the common bile duct and opens into the duodenum. And coming to the endocrine part, endocrine function, the hormonal function, this is made up of the cluster of cells called islet of Langerhans. So islet of Langerhans. So what type of cells are covered within the islet of Langerhans together? Alpha cells, beta cells, delta cells and PP cells. These alpha cells, it secretes a glucagon hormone which helps in raising the blood sugar. And beta cells, it secretes the insulin hormone which functions in lowering the blood sugar. The delta cells, it releases a somatostatin which regulates the other hormones, whereas PP cells are also called as pancreatic polypeptide cells. So this hormone, this cell, it secretes the hormone called pancreatic polypeptide. So this helps in aiding the digestion. So what is the key point of the pancreas you have learnt over here? It is a both a digestive and hormonal organ which is essential for maintaining the blood sugar balance and also the digestive health. And now next coming to the next gland, ovaries. So you all know ovaries are a part of female reproductive system. So these are paired organs. So these are a pair of organs of female reproductive glands that produces ova, nothing but eggs. So these also produces a female sex hormones, mainly estrogen and progesterone. And these are essential for reproduction, menstrual cycle regulation, and the development of female secondary sexual characteristics. So these ovaries serve two main functions. What are their functions? Endocrine function and also the reproductive function. Because in the female reproductive system, it serves the reproductive function. Coming to the endocrine system, it serves the endocrine function. So it has two main functions. Okay. So this coming to the endocrine function, it secretes hormones called estrogen and progesterone. Whereas coming to the reproductive function, it produces and releases the ova. Nothing but ova is also called as eggs. So what is the location of ovaries? This picture is a female reproductive system, and this is a clear anatomical picture of the ovary. So where these are located? These are located in the pelvic cavity, one on each side of the uterus. Here in the picture you can see two pair of ovaries. One ovary you can see at the left side and the other ovary you can see at the right side. So these are present on each side of the uterus. They lie behind and below the fallopian tubes. So this is the fallopian tube. So they lie behind and below to the fallopian tube. This fallopian tube is attached to the back of the broad ligament of the uterus by a fold called mesovarium. So in adult females, each ovary lies close to the lateral wall of the pelvis. So coming to the shape, size and structure of ovaries, they resemble the almond shape. You can clearly see here, it looks like an almond shape, right? So what is the size of these oocytes or ovary? It is about 3 cm long, 2 cm wide and also 1 cm thick. So for appearance, it looks in pinkish gray and which is foam in consistency. So it has both external and internal structure. Coming to external features here, each ovary has two surfaces. What surfaces? Medial and lateral. And it has two borders, anterior and posterior. Anterior is nothing but mesovarian border and posterior is nothing but free border. Here you can see at the top mesovarium. So this is the anterior border, whereas this is the posterior border, nothing but free border. And it has two poles, upper pole, upper tubal end and also the lower uterine end. And the internal structure, ovary has two main layers, the cortex upper layer. Here you can see over here, cortex is the outer layer, and behind here it is the medulla, which is the inner layer. This cortex, the outer layer, it contains ovarian follicles in different stages of development. So there will be a development of these follicles in different stages of development within the 30 days menstrual period. So these follicles contain the oocytes. Oocytes are nothing but it is also called as the immature eggs. So after ovulation, the ruptured follicle becomes the corpus luteum. This corpus luteum, it secretes the hormones. So this is about the cortex, the outer layer of the oocyte. Now coming to the medulla, the inner layer. This medulla is made up of a connective tissue, blood vessels, lymphatics and nerves. So no follicles are present here. So follicles are present only in the outer layer cortex. So in medulla, there is no follicles present. So how does blood supply to ovaries? Ovarian artery. Ovarian artery, it supplies the blood from the branch of the abdominal aorta. Uterine artery, it supplies the blood from anastomosis with ovarian branches. Now about venous drainage. So ovarian vein, this is the ovarian surface epithelium, this is the ovarian ligament. So ovarian vein, to the right side. The ovarian vein to the right side, it drains into inferior vena cava. So to the right side of the oocyte or ovary, it drains into inferior vena cava, whereas in left side, it drains into the left venal vein. So coming to the nerve supply, we have learned about blood supply like arterial and venous, right? So now coming to the nerve supply, it supplies from the ovarian plexus, derived from the aortic plexus and also the renal plexus. It contains both sympathetic and parasympathetic fibers. So it controls blood flow and hormonal activity. Now coming to the microscopic structure of ovary. So when you observe ovary in the microscope, you can find four layers: germinal epithelium, tunica albuginea, cortex and medulla. Here you can see over here tunica albuginea next to cortex. This is the medulla. And the outer layer, it is the germinal epithelium. The outer single layer of the cuboidal cells is called as a germinal epithelium. And the tunica albuginea, it is a dense connective tissue beneath the epithelium. And then cortex, it contains developing follicles. And the inner layer is medulla. It contains connective tissue, blood vessels and also the nerves. So what are the functions of the ovaries? You have learned about the structure, the shape and also the microscopic structure of the ovaries, right? Now coming to the function of the ovaries, they have both reproductive function, endocrine function and also the regulative function. So in reproductive function, it produces the ova which is utilized for fertilization. And endocrine function means secretion of hormones like estrogen, progesterone. So estrogen, it regulates the menstrual cycle and also the secondary sexual traits, whereas progesterone, it prepares uterus for pregnancy. And regulatory function, in regulatory function, these ovaries, it influences the menstrual cycle and also the pregnancy maintenance. So this is all about the ovaries and its function. Now next, coming to the next gland, testes. So ovaries are related to female reproductive system, whereas testes, it is related to male reproductive system. So what are testes? Testes, this is the plural form, whereas singular form, you can call it as testis, right? So these are the male reproductive glands. Glands are also called as gonads. So these are located in the scrotum, which is a pouch of skin that hangs outside the body, behind the penis. So this external position keeps them 2 to 3 degrees Celsius cooler than body temperature, which is an ideal condition for sperm production. So each testis is suspended by a spermatic cord within the scrotum. So this testis has two major functions. What are the two major functions? It produces the sperm cells, which are helpful in reproductive function. So it also secretes the male sex hormones, mainly called testosterone, which is an endocrine function. So these hormones are essential for the development of male reproductive organs and also the secondary sexual characteristics and spermatogenesis. So spermatogenesis is nothing but a formation of sperm. So the process of formation of sperm is called as spermatogenesis. So these hormones which are secreted by the testes are useful for the spermatogenesis. Here you can clearly see a picture, and this is the male reproductive system to the left side, and the right side, it is a microscopic picture of the testis. So coming to the shape, size and coverings, the shape of the testis is oval shape. So this is the testicle and this is the microscopic structure of the testicle. So this, it is oval shape and it is about 4 to 5 centimeter long in size, 2.5 centimeter wide and also 3 centimeter thick. It is approximately 10 to 15 grams each in weight, and to the appearance it looks like in pinkish white color, smooth and firm. So each testis has 3 layers. So you can look over here, each testis has 3 layers, also called as tunics. So tunica vaginalis, tunica albuginea, and also tunica vasculosa. So tunica vaginalis, it's the outermost serous membrane derived from peritoneum, whereas tunica albuginea, it is a dense fibrous capsule beneath the tunica vaginalis. So behind the vaginalis, there is the albuginea. So next, after the albuginea, next to it, you can see the tunica vasculosa, which is the inner layer containing the blood vessels. So this tunica albuginea, it sends inward septa, dividing the testis into lobules. You can clearly watch in the picture. It sends inward septa, and these are the lobules, right? You can see here lobules, which is blue in color. So this tunica albuginea, it sends inward septa so that it will be divided. The testis is divided into lobules. When coming to the internal structure of the testis, each testis is about 250 lobules. So inside the tunica albuginea, you can see the lobules, and these are about in 250 number. So each lobule, it contains 1 to 3 tightly coiled seminiferous tubules. You can watch over it here. This is a seminiferous tubules where sperm are produced. In this tubules itself, in the seminiferous tubules itself, sperm is produced. So these tubules are lined by the germ cells, which is developing sperm, and also the Sertoli cells, which supports and nourishes the sperm. And seminiferous tubules, it unite to form a straight tubules which open into a network called retitestis. So these are all the seminiferous tubules, and these unite to form a straight tubule into a network type, like right here, over here in the inner layer, you can watch a network type, right? So network type tubule called as retitestis. So this retitestis, it's a network of channels in the mediastinum testis, which is a thickened area in the posterior testis. From here, from retitestis, sperm actually passes into the efferent ductules. So these are the efferent ductules, retitestis, and next to the efferent ductules. And from efferent ductules, sperm passes into the epididymis. So epididymis is a place for maturation and storage of the sperm. So you can see this store the sperms within the epididymis, right? And there are the cells in the testis. So what are the cells? Spermatogenic cells, which is also called as germ cells, Sertoli cells, and also the Leydig cells. Now, how does the blood supply to the testis? So arterial supply, testicular artery, it supplies the blood from a branch of abdominal aorta. So venous drainage, Pampiniform plexus, it is a network of veins that cool the arterial blood. So this venous drains into right testicular vein into inferior vena cava, whereas left testicular vein into left renal vein. Here you can see the testicular artery. So this is a branch of the abdominal artery. Through abdominal artery, the blood is supplied through testicular artery and then into the testis, right? So how does nerve supply now? From testicular plexus, which is derived from renal and aortic plexus, which is also a part of sympathetic and parasympathetic fibers. This nerve supply, this sympathetic and parasympathetic fibers, the testicular plexus, it regulates the blood flow and also the hormone function. So what key point we have to remember regarding testes? These are the male gonads, which is responsible for sperm production and testosterone secretion, which are essential for fertility and male characteristics. So this is all about testes. In the next, you are going to learn about the functions of the endocrine system. So what are the function of the endocrine system? Namely, continuous monitoring of the hormones, role of the pituitary gland in endocrine system, hormonal imbalance, and the causes of hormonal imbalance. So coming to the continuous monitoring of hormones, The endocrine system, it constantly checks the amount of hormones in your blood, right? So what are hormones? Hormones act as chemical messengers. So they travel through the blood and attach to the specific target cells to deliver the instructions. So these messages tell the body what to do. For example, when to grow, produce energy, or maintain the balance. And the next function, the role of pituitary gland in the endocrine system. This pituitary gland, it acts as a control center or thermostat for hormones. When hormone levels increases, the pituitary gland signals other glands to slow down the production. So when hormone level drops, it sends the signals to produce and release more hormones. The process of keeping hormone levels stable is called as homeostasis. So pituitary gland is responsible for the homeostasis. It's similar to how a thermostat keeps your room temperature steady. And the other function, hormone imbalance. Sometimes glands may release too much or too little of a hormone. This imbalance can cause various health problems such as weight gain or weight loss, high blood pressure, changes in mood, sleep and behavior, and also the tiredness or overactivity. So what are the causes of the hormone imbalance? So main factors can affect hormone production including illness or disease, stress, certain medications, and also the unhealthy lifestyle habits. In simple words, this endocrine system, it works like a messenger network in our body. So it uses hormones to send signals to different organs. It also acts like a thermostat. So it keeps the hormone level balanced. So if too much or too little hormone is produced, it can affect mood, weight, and also the overall health. So coming to the next slide, it is the conditions and disorders. Now you are going to learn about the conditions and disorders of the endocrine system. There are many conditions and disorders of the endocrine system because it can be affected by many conditions that disturbs the hormone production. When glands makes too much or too little hormone, it causes a hormone imbalance, right? As I said in the before slide. So this hormone imbalance, it leads to various health problems throughout the body. So many condition disorders will be arise from the health problems. So coming to the first condition or disorder, it's diabetes. So what is diabetes? It's a common endocrine disorder that affects how the body uses energy from food. So what is the cause of diabetes? The pancreas does not make enough insulin. So the insulin does not work properly. It results in increasing of the blood sugar, which is leading to the symptoms such as increased thirst and urination, tiredness, weight changes, and also the slow healing of wounds. So in simple way, in diabetes, insulin is either missing or not doing its job, like a key that can't open the door to let the sugar into the cells for energy. So this diabetes condition is mainly dependent on the production of insulin. If insulin does not work properly, then it leads to the condition called diabetes. So the next condition, thyroid disorder. So thyroid gland, it controls the metabolism, like how fast or slow your body uses the energy. So this thyroid disorder, you have hypothyroidism and hyperthyroidism. So what is hyperthyroidism? The thyroid does not make enough hormones. So in that way, hypo, you call it as hypo, and in hyper, if the thyroid produces too many hormones. So symptoms of hypothyroidism is tiredness, weight gain, dry skin, hair loss, and feeling cold. Whereas symptom of hyperthyroidism is weight loss, fast heartbeat, nervousness, sweating, and feeling hot. So if the thyroid is slow, the body slows down, which results in hypothyroidism. If the thyroid is fast, the body speeds up, which results in hyperthyroidism. And the next disorder is hypogonadism, which is low testosterone. So in men, the testis makes a hormone called testosterone, right? So this testosterone, it controls the muscle strength, sex drive, mood and energy. This hypogonadism occurs when the testis doesn't produce enough testosterone. Until and unless the testosterone is produced properly, there will be no condition of hypogonadism. Whenever this testis does not be able to produce testosterone, I mean enough testosterone which is required to the body, hypogonadism takes place. So these symptoms, it includes low sex drive, fatigue and poor concentration, decreased muscle strength, and also the erectile dysfunction. So when testosterone levels drop, it's like the body's energy and drive are turned down, affecting both physical and emotional health. So in the next one, it's a polycystic ovary syndrome, which is also called as PCOS in short form. This PCOS, it's a hormonal imbalance that affects women during reproductive years. So ovaries produce too many male hormones, which is called as androgens. So this causes problems with the menstrual cycle. So the main symptom of PCOS is irregular or missed periods, excess hair growth, especially on the face and body. So when PCOS occurs, you can find the excess hair, especially on the face and body. You can also experience the acne. You can also experience the weight gain. And also, there will be a difficulty in getting pregnant, causing infertility symptoms. And what are the other effects of the PCOS? It also increases the risk of diabetes and the metabolic syndrome. Metabolic syndrome is nothing but it's a combination of high blood sugar, high blood pressure, and also the obesity. So in PCOS, the ovaries does not release eggs regularly and produces too many male hormones. So this leads to irregular cycles, acne, and also the hair growth. And next to the PCOS, now we will talk about osteoporosis. So osteoporosis, so what is the condition called osteoporosis? Why? Osteo means bone, right? So osteo is the medical term of the bone. So this is a condition in which bones bones become weak and brittle due to a lack of hormone called estrogen in women and also testosterone in men. So when reproductive hormones, estrogen and testosterone are lacking in the production, so this condition takes place. So this estrogen and testosterone, it helps keep the bones strong. So who are affected by this condition? Most common in older women after menopause. So after completion of the menstrual cycle in their lifetime, this is most common in older women. It also occurs in men with low testosterone. It can happen in people with overactive parathyroid glands, which removes too much calcium from bones. If there are overactive parathyroid glands, so it absorbs calcium. So this parathyroid glands, it absorbs the calcium levels, right? So when there is an overactive involvement of parathyroid, they consume more calcium from the bones. So what happens if there is low amount of calcium in bones? Osteoporosis occurs. So what are the main symptoms of this disorder? Fragile bones, you can see frequent fractures, and also you can experience the back pain due to bone thinning. And then coming to the endocrine disruptors. So chemicals called endocrine disruptors. So what are these chemicals? So what are endocrine disruptors first? These are the harmful chemicals that interfere with the normal function of hormones. So these are found in pesticides, plastics, cosmetics, food, and also the water. So how they affect you? So what is the role of endocrine disruptors? How they affect you? So what if they affect us? How your body react to it? So they mimic or block hormones and also change the hormone messages in the body. They can cause problems in growth, fertility, metabolism, and also the development. So endocrine disruptors acts like a fake hormones. Fake hormones means they confuse your body's natural signals and can lead to the hormone imbalance. So these are the disorders. And coming to the next disorder, gigantism. So what do you mean by gigantism? It is nothing but it's an overproduction of the growth hormone. So where does the growth hormone produced? It is produced by the pituitary gland. So when before the bone growth plates closes in the children. So what it affects? It affects causes it excessive growth of bones and tissues. When gigantism takes place, it causes the excessive growth of bones and tissues. So what are the symptoms of gigantism? Abnormally tall height, large hands and feet, and facial features may appear enlarged. So your facial expressions and also the features, they become enlarged. I mean normal, beyond the normal. So in gigantism, too much growth hormone in children makes them grow unusually tall because their bones are still developing. So the next disorder, acromegaly. What is meant by acromegaly? What is the cause actually? It's the overproduction of growth hormone after the bone growth plates have closed. So gigantism before the bone growth plates close, and acromegaly is the condition after the bone growth plates have closed. So this affects, I mean this gigantism you can see in children, whereas acromegaly you can see in the adults. So this effect, this acromegaly, it affects the bones so that they can't grow longer but become thicker. So only the width size increases but not the length. So what are the symptoms of acromegaly? You can see the enlarged hands, you can see the enlarged feet, and also the facial bones. You can also experience the joint pain and tiredness. So this is all about the acromegaly. And coming to the next disorder is goiter. So what is goiter? It is the enlargement of the thyroid gland, usually due to iodine deficiency. So whenever your body is low in iodine content, you can see the enlargement of thyroid gland and also the iodine deficiency. So what are the symptoms of the goiter? It includes the swelling in the neck. Sometimes it is difficult in swallowing or breathing. So you can't swallow properly. You can't take the breath inside. I mean you can't intake the oxygen and exhale the carbon dioxide. So this goiter, it makes difficulty in swallowing or breathing. So the simple key point about goiter is it's a sign that the thyroid gland is swollen, often because the body doesn't get enough iodine from food or salt. So you can see mostly the swelling in the neck. In the neck part, you can see the swollen one so that you can identify it is a goiter. So next to the goiter, it's a Cushing syndrome. So what is Cushing syndrome? What is this condition? It is a condition where excess production of cortisol takes place. So what is cortisol? It's a hormone made by the adrenal glands. So what are the symptoms of Cushing syndrome? You can experience the weight gain, especially around the face and trunk area. You can also see a moon face, which is round and puffy face, and normal face turns out into a round and puffy face due to this Cushing syndrome. You can also experience the high blood pressure and also the muscle weakness and thin arms and legs. So that's it guys. This is all about today's session. In this session you have learnt about the anatomy and physiology of some of the endocrine glands, and also you have learnt about the disorders and diseases of the endocrine system. So in the next session you will be learning about the hormones released by the endocrine system and also the medical terminology of the endocrine system. And thank you. Have a good day.